Let me introduce a truly remarkable advocate. Diane Archer is an attorney, a healthcare authority. She is the past president and co-founder of the Medicare Rights Center, a national consumer service dedicated to ensuring that older and disabled Americans get the health care they need. We're proud to say she's now special counsel and co-director of the healthcare project at our Institute for America's Future, providing critical work in building the new coalition that gets launched this week called the Healthcare for America Now Coalition that will ensure that we drive the issue of universal health care into the campaign over the next months. Diane Archer.
I'm happy to be with you today to talk about health care reform. You've seen the headlines. New York Attorney General Cuomo sues United Health Group and subpoenas 16 other insurers over reimbursement practices that allegedly cheated consumers out of hundreds of millions of dollars. The World Health Organization's report ranking the world's health systems is out, and the United States of America, the wealthiest nation in the world, ranks 37th behind such progressive stalwarts as Morocco and Chile. One of California's largest for-profit insurers is forced to stop canceling sick policyholders after a judge ordered HealthNet to pay more than $9 million to a breast cancer patient it dropped in the middle of chemotherapy. By any measure, our health insurance system is a failure. It is the emperor of economic injustice in this country, and the emperor has no clothes. At the same time, those of us who work in healthcare policy have never been so excited, have never been so optimistic about the prospect of meaningful reform. Early in the next administration, we have a real chance to banish the emperor for good and fix this country's disgraceful healthcare system. And I am thrilled to announce today that a coalition of organizations, grassroots, netroots, and social justice organizations, unions, providers, and businesses is launching Healthcare for America Now, a campaign to create a public outcry for meaningful, structural, and lasting changes to our healthcare system that will guarantee quality, affordable healthcare for all. This isn't the first time the progressive community has coalesced around the intersection of healthcare and social justice. More than 40 years ago, a different coalition built a powerful political constituency for healthcare reform and created Medicare to fix a portion of our healthcare system. Medicare is a simple, if imperfect, public insurance program, and it works. It guarantees health security to older Americans and peace of mind to their families. Medicare assumes risk, pools risk, and spreads risk. It is affordable and relatively efficient. It provides older adults and people with disabilities full choice of doctors and hospitals, protects them from financial risk, and assures them access to needed care. We all contribute to a public insurance pool, and the government takes care of our parents and grandparents when they become eligible. Many people expected that Medicare would eventually grow to cover increasing segments of the population, children, early retirees, the unemployed, and eventually everyone. Instead, what has grown is the number of people in this country without adequate, affordable health insurance. By some estimates, 120 million of us, 40% of the population, have no coverage or inadequate coverage to handle a medical crisis. What has grown is the influence of the private health insurance industry on policymakers, and what has grown is a false ideology that government cannot play a meaningful role in a robust, innovative health system. At every step in this 40-year journey, defenders of private insurance have worked furiously to undo and marginalize Medicare, to make us believe that public insurance doesn't work, and to make it seem inevitable that private insurance is the only option for working families. Even now, they tell us that public insurance isn't a pragmatic solution, that the political system won't accept it, that the government Guaranteed health insurance will always remain the province of overweight documentary filmmakers. We are going to prove all of those talking heads wrong, dead wrong. We have been given a brief window of opportunity to engage the public in a debate about the future of healthcare in America that we can win and we will win. We can and we will demonstrate that it is wrong and irrational to allow the private health insurance industry to strangle our health, our security, and our economy. We can and we will teach the public that reforming or regulating the current system cannot overcome the basic truth that the private insurers will always seek profits before our health care. Profits earned through avoiding people with costly and complex conditions. Profits earned by denying us coverage when they can without having to justify their decisions or expose them to public scrutiny. Our solution is simple as it is controversial. We plan to skip the debate over whether public or private insurance is the right answer to our healthcare crisis. That debate is a trap, and we will not be baited. Instead, we back a program that will retain employer-based insurance for those who like it and can afford it, while creating a public insurance option, a better Medicare for those who like it. Let people keep their private insurance if they like it, but give them the choice of public insurance as well. Our healthcare reform principles underlie the reform plan of Yale political scientist Jacob Hacker, who will be talking about his plan later this morning. Senators Clinton and Obama have both adopted the Hacker model without much detail. Our first job is to launch and influence a robust public debate about the value of guaranteeing people the choice between public and private insurance. Our second and much more important job is to insist that the next president and Congress keep their campaign promises despite the vast right-wing conspiracy that we are sure to unleash, and implement a meaningful legislative solution to the healthcare crisis. Why have we chosen this route? In poll after poll, 2/3 of the public across the ideological divide support a choice between public and private insurance, so long as they can keep the insurance they have. They support it even if it means higher taxes, even if it means a larger government role in health care. People are deeply suspicious of private insurance. They think the insurers are greedy and bureaucratic, charge them too much, and may not be there when we need them. But private insurance is the devil they know, and it will take education and experience to show them that public insurance works and works better. Can this hybrid system succeed in reforming the healthcare system? Absolutely. In a recent cost-impact analysis of a public-private health insurance model commissioned by the Economic Policy Institute, the Lewin Group projected that over 1/3 of all Americans would immediately move into public insurance, and that the public insurance option would drive over $80 billion in annual savings. That kind of competition between private and public insurance can work. It works with Medicare, with 4 out of 5 people choosing the public Medicare plan, even though the private plans are still being given extra subsidies. We need you to join with us as we build a social movement on the ground, in the media, among our leaders. We can guarantee affordable health care for all, but it will take a core of ordinary people unwilling to settle for anything less than real change. It is we who move mountains, not the president or the members of Congress, when we believe, when we are organized, when we demand. We must insist on the choice of insurance we can count on, public insurance. Talk about it, write about it, and believe in it, not just in theory, but in fact. Insurance that's here today and here tomorrow. Insurance that works for everyone in this country. Healthcare for America now. Thank you.